interaction. And finally, we have Brahmanyana, which teaches the relationship with the Almighty. So all these things attend to an individual all round. Nothing is left. If you take the popular yoga systems, they will either focus on asanas or the breathing practices, pranayama, or meditation. Whereas Maharishi has put all the limbs together. So this is because he has come latest. It is only 70 years old, not ancient like, whereas the other systems are thousands and thousands of years old. So since he has come late, in his time, science has also developed so much. So he has more scientific understanding of his yoga, and he explains his yoga in scientific terms. Okay, sir.
Great, sir.
Rangasamy.
Fantastic. So today, am I right in saying that we've got some students or people who are doing some research, doing some presentations?
50% research scholars and 50% are senior professors, and another 5 or 6 are doctors who do involved in the research. It is essentially the research group.
Now, if it's okay with you, my presentation is mainly related to the clinical side of things, sir.
Oh yes.
I'm slightly ashamed and disappointed to say that Yoga Insight romba minimal, but I've written a book on diabetes demystified, and I've taken one chapter, diabetes and yoga, but I copied from Ravindran et al. 2018. It was a fantastic paper published on good effects of yoga and diabetes. So I'm just learning something of it. So now, at least clinical, what we are seeing at the portrait, how can the two disciplines link up to do some proper research, which are outcome-based rather than anecdotal? That is my aim.
Yes. Okay, and it suits us. This is what we are expecting also. And we are also in the process of starting our research.
Doctor.
All right, just take over.
Malay Vanakkam.
We'll formally welcome all of them, including the doctor. Doctor, we have read your book. I got it from KMCH as a present.
Thank you, sir. Nalla titlam, onno public la titlam nalla, but useful irundha.
It was a gift from your chairman, Nalla Palliswamy.
Yeah.
We were instrumental in you may not be knowing, I didn't tell you that we were instrumental in creating the hospital. I was in Tata Motors at that time. He came from US, and I took him to Bombay to get equity capital. That was a breakthrough for him and for all of you.
Thank you. Thank you.
All the time he prayed for his recovery. He got through. Everything will go, but he struggled this time.
But patience or blessings so Andavan Karnaya irundhudu, sir. He's doing really well.
Of course, I put a note to him that we all jointly prayed, and this is we believe very strongly. Dr. Ravindranath will tell you, blessings and benefits is one of the biggest philosophies of Vedadri Maharishi, and definitely in the course of our interactions with you, we will reveal some of the secrets through these yoga sessions. Okay,
Definitely, sir.
now over to
I'm here to
doctor.
learn.
We are very grateful to the great doctor coming from KMCH. It is a proud moment for all of us. Thank you. We welcome you wholeheartedly. All yours. Can we go
Pleasure,
ahead with
sir.
the program, doctor? Anybody else is coming?
Can go ahead from my point of view, sir.
Now, we normally start off with the previous session's review, and today's review was supposed to be our Dr. Sundra Devi ji, and has she come on the line?
Yes, I'm here, doctor.
Oh, we are all, yeah, you, thank you very much. You have relieved me. You are the best person to say what happened last week. Otherwise, I had to reread and then get these technical terms. Medical terms, and also the technical terms. I was praying that you will come. You came to my rescue. Thank you.
I'm ready. Oh. Should we go ahead?
Yeah.
Yes,
Doctor Ravindra ji, anything else you would like to say?
No,
You can
carry on, carry on.
Okay, வாழ்க வளமுடன். Last week's program started with the introduction of Dr. Natarajan by his classmate and friend, Dr. Shanmugavelu. We could see that Dr. Shanmugavelu was very happy and proud to do this introduction. And Dr. Rangaswamy presented the summary of the last meeting. Dr. Natarajan, as usual, has given an exemplary and exhaustive presentation with very good slides and explanations. And with his vast experience, he also told us that he has pioneered a study of assessment of cardiovascular function after yoga intervention. In the beginning itself, he outlined a very clear picture of his speech. There are 3 points, he said. One is the cardiovascular benefits of yoga. Second is how the yoga brings on this effect on the cardiovascular system. And third, the available methods of assessment of cardiovascular effects. So first he said how yoga has beneficial effect on all the risk factors of cardiovascular disease, like diabetes, obesity, hypertension, dyslipidemia, and stress. And he also discussed the causes of each factor in short detail. And he stressed on the faulty lifestyle and which yoga corrects. Second thing, he describes the effects of yoga on 3 parameters. One is the neuroendocrine parameter, second is hemodynamic, and third is the metabolic parameters. And in the neuroendocrine aspect, anatomically, he said yoga increases the gray matter of the cerebral cortex and the hippocampus. And physiologically, it has favorable modulation on the chemical effects, that is increased GABA, oxytocin, endorphin, serotonin. That is all the good hormones. And it has a decreased effect on decreases the stress hormones, cortisol and catecholamines. On the hemodynamic aspect, he said there is a decreased sympathetic nervous system activity, so leading to decreased hypertension, systolic BP and diastolic BP, in decreased pulse pressure and in decreased peripheral resistance. That is all the factors good for the heart. And there is increased vagal tone, increased stroke volume, and increased cardiac output. So all the good effects are increased and all the bad effects are decreased. And on the metabolic side, he said there is decreased insulin resistance, decreased lipids, cholesterols, which lead to atherosclerosis.
Madam, your voice is not clear.
Some net connection problem.
Signal is poor. I think so. கொஞ்சம் ஹெல்ப் பண்ணுங்க. கால் வந்திருக்குது இல்லையா? ஓ. This week we have more calls. Dr. Krishnan had one, I had just now one, and Dr. Devi is here.
I think still she is not able to connect it up.
We will ask one of our presentations. Thamrai Selvi, shall we ask Thamrai Selvi to present it briefly before Swatantra Devi comes?
Okay, sir. Sure, sir. Sure.
Yes.
2 minutes, sir. I'll connect the share the screen.
Okay, okay. This may be a new experience for you, sir.
Sorry, sir. Well, all these things happen, sir.
Just allow Swaminathan to talk, then we can proceed now, sir. He's
Huh?
also almost Sutra Devi covered the main point.
Yeah, yeah.
I think so. She has covered most of the key points, Doctor.
So, Swaminathan,
Right. So we request you to start your presentation, sir. Oh, Thamrai has come. This will be for just 5 minutes, 10 minutes, sir.
Go ahead, Thamrai Selvi. Quickly finish off within 5 minutes.
Quickly.
Am I audible, sir?
Yes, very much. Carry on.
And my screen is viewable, sir.
Yes, your slide is seen.
Yeah. வாழ்க வளமுடன். Thank you for giving me this opportunity. And first of all, my prayers and thoughts to all the frontline health workers and the doctors, reputed doctors present here. Thanks for your service, and I pray for all your safety and your family's safety as well. And today's my topic is on sympathetic and parasympathetic nervous system, which my co-scholar Aruna Golani and myself have designed this PPT. So, introduction: the English physiologist John Newport Langley, who coined the term autonomic nervous system, had 3 components in mind. The enteric nervous system, meaning referring to the wall of the gut; the parasympathetic nervous system, which is another phrase that Langley coined; and the sympathetic nervous system. The name of the sympathetic nervous system can be traced to the concept of sympathy in the sense of connection between parts, first used medically by Galen. In the 18th century, Jacob B. Winslow applied the term specifically to nerves. The nervous system is the master controlling and communicating system of the body, and it controls and coordinates all essential functions of the human body. The human nervous system is a sprawling networks of nerves and cells which together regulate all of the vital functions that takes place in our body. The sympathetic nervous system and the parasympathetic nervous system are both components of the autonomic nervous system. Together, they regulate the involuntary and reflexive functions of the human body. This is the structure and functions of the neurons, which are the basic elements of the nervous system. And the parts are nucleus, dendrites, cell body, axon, terminal end fibers. Neurons cell body is nothing but the main processing center of the cell. Dendrites, thin branching extensions of the cell body that conducts nerve impulses towards the cell body. Axon, a single branch in most neurons which conducts nerve impulses away from the cell body. Myelin sheath and neurulema are coverings. Impulse transmission terminal and end fibers which are located at the ends of the axon, and they transmit impulses leaving the neurons across the synapse to the next neurons. This is the nervous system division, where nervous system is divided into central nervous system and peripheral nervous system. And peripheral nervous system again goes to efferent division and efferent division. Efferent is nothing but sensory division and efferent is nothing but motor division. And efferent division is again divided into somatic and autonomic nervous system. Somatic is a voluntary system. Autonomic is an involuntary system. Now today's topic is autonomic nervous system and the sympathetic and parasympathetic. That is, autonomic nervous system is divided into sympathetic and parasympathetic and enteric nervous system. And sympathetic nervous system succumbs the thoracolumnar outflow, and parasympathetic is nothing but the cranial sacro outflow. Sympathetic comes from the thoracic and lumbar region, T1 to L2/3 of the spinal cord. And parasympathetic system, which is a cranial sacral outflow, comes from brainstem, cranial nerves 3, 7, 9, 10 or the sacral spinal cord S2. Autonomic nervous system is involved in a complex of reflex activities which depend on sensory input to the brain or spinal cord and on motor output. It is the part of the peripheral nervous system that is responsible for regulating the involuntary body functions. The majority of the organs of the body are supplied by both sympathetic and parasympathetic nervous, which have opposite effects that are finely balanced to ensure the optimum functioning of the organ. The autonomic nervous system is a complex set of neurons that mediate internal homeostasis without conscious intervention or voluntary control. Autonomic nervous system is named so because it works autonomously, that is, without a person's conscious effort. Apart from maintaining the body's internal environment, it is also involved in controlling and maintaining the following life processes, which are digestion, metabolism, urination, defecation, blood pressure, sexual response, body temperature, heartbeat, breathing rate, fluid balance. Autonomic nervous system is divided into sympathetic nervous system and parasympathetic nervous system. The third one, enteric, is not today's focus. So we have designed for sympathetic and parasympathetic. So sympathetic nervous system is a stimulating system. It is a part of autonomic nervous system located near the thoracic and lumbar regions in the spinal cord. It is otherwise called as thoracolumnar system. Its primary function is to stimulate the body's fight or flight response. It does this by regulating the heart rate, rate of respiration, and pupillary response, and more. The sympathetic nervous system releases the hormones epinephrine and norepinephrine that accelerate the heart rate. The sympathetic nervous system comprises of cell bodies that lies within the gray column of the spinal cord. This is the sympathetic nervous system figure, which shows the trigger, the fight or flight responses. Parasympathetic nervous system, which is the inhibiting nervous system, it is located in between the spinal cord and the medulla. It primarily stimulates the body's rest and digest and feed and breathe response. It is otherwise called craniosacral outflow. Its general effect is that of a peacemaker, allowing restoration process to occur quietly and peacefully. The parasympathetic nervous system releases acetylcholine, the hormone that slows down the heart rate. Salivation, urination, lacrimation, defecation, and digestion are the important body activities stimulated by the parasympathetic nervous system. The parasympathetic nervous system is composed of cranial and spinal nerves. This is the figure for parasympathetic nervous system, which is rest and digesting function happening there. And difference between sympathetic and parasympathetic. The sympathetic nervous system prepares the body for the fight or flight responses during any potential danger. On the other hand, the parasympathetic nervous system inhibits the body from overworking and restores the body to a calm and composed state. The difference between the sympathetic and parasympathetic are differentiated based on the way the body responds to the environment stimuli. The difference between sympathetic and the parasympathetic divisions typically functions in opposition to each other, with one division exciting, triggering, or activating a response that is countered by an alternate system which serves to relax, decrease, or negatively modulate a process. However, this opposition is better termed complementary in nature rather than antagonistic. For an analogy, one may think of the sympathetic division as an accelerator and the parasympathetic division as a brake. Difference between sympathetic and parasympathetic nervous system targeting the organs. Digestive system, parasympathetic increases peristalsis and amount of secretion by digestive glands. Sympathetic decreases activity of digestive system. In liver, it is parasympathetic has no effect. Sympathetic causes glucose to be released to blood. In lungs, constricted by bronchioles happening due to parasympathetic, and due to sympathetic dilates bronchioles. In urinary bladder and urethra, it relaxes sphincter, and sympathetic constricts sphincter. In kidneys, there is no effect due to parasympathetic. Due to sympathetic, it decreases urine output. In heart, it decreases the rate. Sympathetic increases the rate. In blood vessels, parasympathetic has no effect on most blood vessels. In sympathetic, constricts blood vessels. In viscera, increases BP. In salivary and lacrimal glands, stimulates, increases production of saliva and tears. And sympathetic inhibits, results in dry mouth and dry eyes. In eyes, stimulates constrictor muscles, constrictor pupils due to parasympathetic. Due to sympathetic, it stimulates dilator muscle and dilates pupils. In eyes, ciliary muscles stimulates to increase bulging of lens for close vision, and sympathetic inhibit decrease bulging of lens, prepares for distance vision. In adrenal medulla, the parasympathetic has no effect. Due to sympathetic, stimulates medulla cells to secrete norepinephrine and epinephrine. Sweat glands of skins, there is no effect. Due to sympathetic, it stimulates to produce perspiration. A difference between sympathetic and parasympathetic nervous system in a figure representing the organs related to the functioning. Parasympathetic constricts pupils, sympathetic dilates pupils. Parasympathetic stimulates saliva, sympathetic inhibits salivation. Parasympathetic slows heartbeat, sympathetic increases heartbeat. Parasympathetic constrict airways, sympathetic relax airways. Parasympathetic stimulates activity of stomach, sympathetic inhibits activity of stomach. Parasympathetic stimulates gallbladder, sympathetic inhibits gallbladder. Parasympathetic stimulates activity of intestines, sympathetic inhibits activity of intestines. Parasympathetic contracts bladder, sympathetics relax bladder. Potential problems as we have to discuss is when the parasympathetic and sympathetic components of the autonomic nervous system becomes out of sync, people can experience an autonomic disorder, also called dysautonomia. These disorders can occur alone or a result of other conditions that cause disruptions in the autonomic nervous system, including these aging, alcohol or drug abuse, autoimmune diseases, cancer, chronic fatigue syndrome, diabetes, Parkinson's disease, peripheral neuropathy, spinal cord disorders, trauma. Some people experience any cluster at one time and the symptoms of other times also. The symptoms can be fleeting and unpredictable or triggered by the specific situation or actions. Difficulty emptying the bladder, disturbing aches and pains, dizziness or light headaches upon standing, erectile dysfunction, faintness, fatigue and inertia, gastrointestinal symptoms, hypertension, lack of pupillary response, lack of sweat or profuse sweating, numbness and tingling, severe anxiety or depression, tachycardia, fast heart rate, urinary incontinence. So here comes the role of yoga and nervous system. Mindful execution and conscious breathing of yoga poses helps to strengthen nerve transmissions from your body to your brain, reducing your stress and muscular tension. Restorative yoga poses trigger the parasympathetic nervous system, eliminating anxiety, fear, and anger out of your minds forever. Yoga and relaxation techniques gradually reduces sympathetic dominance, resulting in a decrease of pulse rate. Further, yoga and relaxation practice leads to reduction of stress induced sympathetic overactivity by overcoming stress itself, leading to lowering of RHR. The sympathetic dominance gradually diminishes with yoga and relaxation practice, resulting in better balance between both the sympathetic and parasympathetic nervous activities. Moreover, decreased sympathetic tone caused by yogasanas leads to decreased peripheral resistance in blood vessels and leads to fall in blood pressure. Yogic exercises involve physical, mental, and spiritual tasks in a comprehensive manner. It brings about the behavioral changes. Yoga in long duration affects hypothalamus and brings about decrease in the systolic and diastolic BP through its influence on vasomotor center, which leads to reduction in sympathetic tone and peripheral resistance. Yoga intervention showed, these are all the studies which intervention showed significant shift in autonomic balance towards vagal dominance, significant reduction in heart rate, systolic and diastolic and mean blood pressure, and reduction in stress, anger, depression, anxiety, and neurotic symptoms, improved symptoms, arrhythmia burden, heart rate, blood pressure, anxiety, and depression scores, and several domains of quality of life in individuals with arterial fibrillation. And according to a recent mini review by Ines and Selfie, Frontiers in Psychiatry 2014, meditation reduces perceived stress, anxiety, and depressive symptoms, enhance quality of life, decreases sleep disturbance, improves several domains of cognition, reduce sympathetic activation, and enhance cardiovagal tone, both acutely and long-term in clinical as well as non-clinical populations. Meditation is a technique of autogenic relaxation. It claims to deal with the inner world, and it is a technique of self-exploration. Regular practice of meditation and various yogic exercises have been observed to maintain optimum level of autonomic equilibrium at rest and during exposure to stressful condition, according to Selvamurthy 1984. Meditative practices diminish sympathetic dominance, resulting in later balance between sympathetic and parasympathetic system, according to Anand 1991. So meditation is commonly thought to reduce stress by a combination of two pathways. First, by reducing somatic arousal, physiological effects, thereby reducing reactivity of the individual to environmental stresses. And second, by altering the individual's cognitive appraisal of and perceived self-efficacy with regard to stressors, according to Monaco 2011. Most of the meditative techniques works by affecting the ANS, in turn regulating many organs and muscles, controlling functions such as the heartbeat, sweating, breathing, and digestion. One possible way for meditation to act on autonomic activity is through respiration control, according to Raghavendra 2011. So these are the two reviews which I will tell you in one line. That is Rika Kinmoto et al. Assessed the effects of yoga practice sessions, herein referred to as yoga on ANS function, and focused on the relationship between ANS function and subject age or personal history of yoga. They attended a 90 to 120 minute, the 113 healthy females participated in this study. They attended a 90 to 120 minute yoga practice session conducted by a well-qualified instructor. The study suggested that yoga for females supports well-balanced ANS function, and the continuation of yoga over a period of time contributes to an improvement in ANS function. Julia Frank
How
et
many
al.
slides more?
The last slide. This is the last slide.
Right. Right.
So Julia Frank et al. Has evaluated the potential effects of yoga on autonomic regulation in young adults by analyzing heart rate variability. The study, 14 healthy young adults took part in a 10-week yoga program, 90 minutes once a week in school, and were compared to a control group of 11 students who participated in conventional school sports 90 minutes once in a week over 10 weeks. 24 hour electrocardiogram were recorded at the baseline and following the 10-week intervention. In this explorative pilot trial, an increase of HRV, more parasympathetic dominance, and overall higher HRV after 10 weeks of yoga in school in comparison to regular school sport was demonstrated, showing an improved self-regulation of the autonomic nervous system. Thank you all for giving me this nice opportunity. Thank you.
Okay. Rangaswamy, we will
Well
take
done.
up the questions later. So we will invite the
We will get
speaker.
the comments
to
from our
present.
other eminent doctors later. Now we will go on to the main topic and main speaker. We have made him wait. Sorry, sir. We can now start off. Over to you.
Not at all. It's a pleasure is mine. I think it's important that I also learned something from other disciplines. First of all, many thanks for the invite. The one disclaimer I want to give beforehand is that I'm no expert in yoga. I don't even know the basics of it. So my strength is on the clinical side of things. So I'm just going to talk about what we see in day-to-day practice, what are the clinical implications of diabetes and thyroid problems, and how we can interconnect disciplines. So I can give a few pointers as to where research can be conducted with these two areas together. So bear with me if I don't want to speak some theory about yoga going through Google without knowing what I'm talking about. So can I share my screen?
Yes.
Yes, please. Go ahead.
Audio is clear, isn't it?
Yeah, audio very clear.
Okay. So I'm a consultant endocrinologist based at Kovai Medical Center Hospital, Coimbatore. So my big area of expertise is in diabetes and thyroid, which is our breadwinner for us. 90% of all our patients have got either diabetes or thyroid problems, which is a very common problem in the community. I'm sure in your group, most of the people who come have got diabetes, plus or minus thyroid problems. So I'm just going to talk about what is the burden of diabetes in India, what happens if diabetes is not controlled properly, what are all the Indian solutions that we can have, and how yoga can connect with our discipline. So I don't think it's an exaggeration to say that there's a huge explosion of diabetes in India. I'm sure if you think about it, someone of our family will have diabetes. And it started with 31 million in 2000, 62.4 million in 2011. That is within a decade, there's doubling. And as we speak, it's crossing 77 million. And I really think it's an underestimate. For every one person with diabetes, we probably have one who's undiagnosed. And you might want to ask, Sari, is there a problem with the diabetes now? What is the big deal? A lot of people think that diabetes is all about urlakirangu, sepangirangu, and diet and lifestyle alone. That matters a lot, but it's much more to it than that. So I'm 30 years from medical college now. I keep telling that there is a medical college definition of diabetes and a clinical definition of diabetes. We are doctors because we have no other natural talent apart from mugging up very nicely. So we can mug up 2000 pages of Harrison's textbook of medicine, left, right, and center. So if I was asked in my medical college, how do you define diabetes? Diabetes is a state of chronic hyperglycemia due to absolute or relative deficiency of insulin or resistance to the action of insulin. But after 30 years of doing medical practice, if someone asks me now, how do you define diabetes? The definition has changed completely. We just say that diabetes is a state of premature cardiovascular death if uncontrolled. A lot of patients think, Dr. Bayamurtha aramistingla ninga, We are great at frightening people. What is the link between diabetes and heart attacks and strokes? It's also associated with chronic hyperglycemia. Glucose levels are high, but very importantly, maybe also associated with blindness, amputation, and renal failure. Today, we had 5 amputations related to diabetes. In fact, it's the second most commonest cause of foot amputations in India next to road traffic accident. And this is in a very low season where because of COVID, our non-COVID admissions are pretty low. It's the major cause of blindness amongst working age people in India. And 70% of all dialysis unit kidney failure is because of uncontrolled diabetes. But the most important point here is if uncontrolled. So I'm not here to frighten people. The great news is if you control it properly, these things are not bound to happen, or it's less likely to happen. So எதனால இது சர்க்கரை நோய் ஒரு அமைதியான கொலையாளி. It's a silent killer for a reason. So when the glucose levels increases, it causes something called endothelial dysfunction. The glucose gets attached to the lining of the blood vessel on the inside, and that causes attachment of bad cholesterol to the inside lining of the blood vessels. And no one will have any symptoms whatsoever when these things happen. And suddenly one fine day, it will lead to a major heart attack, stroke, blindness, or kidney failure. So I think it's very important that we take care of the numbers, keep an eye on the glucose levels, and have certain parameters which have been scientifically proven that if you keep levels under control, then these complications are very unlikely to happen. And these are some of the clinical photographs of my recent patients. We're seeing a huge increase in tuberculosis because of uncontrolled diabetes in recent times. And this is a cavitating tuberculosis on a very young person. This is an ECG of a 32-year-old with a major heart attack related to diabetes. Our big worry is 40% of our acute admissions with heart attacks and strokes are between age around 28 to 40 years of age. So there's a big increase in numbers of young people with diabetes suffering with major heart attacks. And this guy, take it from me, is not going to live for the next 2 years. He had major acute left ventricular failure, and the prognosis is equal to middle grade malignancy. So this guy will keep on getting admitted every month or 2 with heart failure, and one day he'll go into cardiac arrest. There's a 37-year-old PT teacher, for God's sake, looking otherwise fit with diabetes and has a scar here because of a bypass surgery at 37 years of age. Dialysis, this is retinopathy. Again, a lot of doctors dealing with diabetes don't even think about the eyes. So it's a major cause of blindness, and no one will realize anything till one day the artery ruptures, and a major cause of foot amputation. So the reason why I'm telling all this is that we need to just not only think about diet, lifestyle, but think about the medical complications of diabetes. One hospital admission will break families. One admission in a very good corporate hospital will cost 5 to 8 lakhs. And per month treatment is around 6,000 to 8,000 rupees. And the great thing is these are all preventable if only there was awareness, a bit of education on the part of healthcare professionals, and understanding on the part of patients. And hypertension, again, there's a huge problem. Again, these 2 areas where yoga can really help, as you have heard about the sympathetic and parasympathetic system. A lot of hypertension is related to sympathetic overdrive, where the adrenaline and noradrenaline levels are much higher. That increases tachycardia and increases the arterial blood pressure. And this is a study from the Delhi group CARS cohort, where 1 in 3 men and 1 in 4 women in India have hypertension. And only 20% of those with hypertension have a good control. And among those who did not have hypertension, 1 in 6 developed hypertension within a 2-year period. That's pretty high for developing countries, and it's higher in lower socioeconomic status where they can't bear the expenses of a major hospital admission. So this is what we are seeing in our day-to-day practice, where this combination of hypertension, sedentary lifestyle, diabetes, obesity, alcohol, and smoking just destroys families because one admission, and they have to pay the interest for 5 generations together, just one hospital admission, and this is preventable. So Thiruvalluvar says very nicely, Pilipai, Sagadum, Achirum, Appandam, Salam, Migathipai. Peacock feathers are light, but when you add a lot of peacock feathers, then the axle snaps in a moment. And that's what is happening that we see. Now you might want to ask, Doctor, in the data, okay, what is the data around Coimbatore districts? So I'm the president of KMCH Research Foundation, and our job is to do a lot of epidemiological work on non-communicable disease around Coimbatore districts. And this is some original data. For the first time, we are seeing what is the burden of non-communicable disease here. The green line is from Nallambatti, which is our chairman's village, which is a very good farming village near Erode. The blue line is Tadagam, which is suburban Coimbatore, where there's a lot of brick kilns. And the red lines is Kalapatti, which is within Coimbatore, urban area. We are seeing a prevalence of diabetes of around 16% in a rural farming village. That's really worrying. Another 1 in 6 have diabetes in an absolutely farming village where people work day and night. And if you go to urban and semi-urban areas, it's 25%, meaning 1 in 4 adults in and around Coimbatore have diabetes, age more than 20 years of age. And if you look at pre-diabetes, that's worrying. So these are the people who can go on develop diabetes over the next 10 years, and that's around 35 to 40%. Obesity is around 35 to 50% in urban areas. Hypertension is around 40%, and hypercholesterolemia is around 30 to 40%, meaning that what our data is showing is that 1/3 of the rural, urban, and semi-urban population in and around Coimbatore are a sitting duck for major cardiovascular disease over the next 10 to 15 years. And we need to prevent this from happening. So what are the causes of this huge burden of diabetes and hypertension over the last 10 to 20 years? I keep saying the 5 Gs. So the first one is genetics. Being born a South Asian increases the risk of diabetes and hypertension compared to Caucasians. The next one, I put greediness for food and money. So we keep on eating a lot, which we should not be eating. We keep on chasing after money, lose our patience, lose our relaxation, and get all these kind of stress that increases the diseases. There's a general perception that being obese is good and being fit and thin is bad. Gadgets are a huge source of concern. We are having 2-year-olds and 3-year-olds looking at their iPhones and their Androids for hours together. And in fact, recently, one of my neurologists said that there were 20 cataract surgeries done in young children in Parani on children who are looking at their gadgets for a long time. And this is the area for research. We are working with IIT Madras, looking at pesticides and fertilizers in our food, which increases hypoglycemia. So genetics is an important factor, which we can't change. So we got to be proud about being an Indian. But this is the YY paradox. This is a great slide that we use in all our diabetes meetings. This is Professor Yukin from Imperial College London, and this is Professor Yajnik from Pune. Both have the same body mass index. This is the weight divided by height squared at 22.3. But the Caucasian has a body fat of 9.1% compared to 21.2% to an Indian, meaning that for a same body mass index, we have twice the amount of fat in the liver and omentum that causes insulin resistance compared to a Caucasian. But is genetics alone enough? It loads the gun, but the environment pulls the trigger. Number food concepts, number. We don't know what normalcy in eating is all about. A lot of my patients think that eating 10 to 12 idlis per serving is normal. So normal தான் சார் சாப்பிட்றேன் அப்படிங்க. Weight 150 kilograms, normal தான் சார் சாப்பிட்றேன். 12 idli மட்டும் தான் சாப்பிட்றேன் அப்படிங்க. And great culture and tradition here where we eat a lot and still be worried that we are not eating enough. So there's a famous advertisement in Madurai, 5 dosai சாப்பிட்டால் ஒரு தோசை இலவசம். If we eat 5 dosas, you get 1 free. And freebie culture in Tamil Nadu state, our guys will eat the 6th dosa just to get that 1 free dosa. So there's a lot of things that are going on in the environment. There's a great slide from the cover of Economist, where human beings 20 million years ago were so fit and well because they were hunter-gatherers, but now they've got everything in hand and now doing enough exercise. And we all know what we do when we buy the dog. We know who does the treadmill. Man still has a happy way of making sure dog does the treadmill and he watches television. So this is our area of research, and we have published around 10 papers recently. And the pesticides that we have in our food, it goes into the gastrointestinal tract and it's broken down by the gut microbiota into toxic metabolites like acetate, which go into the liver and increases gluconeogenesis. This is from a paper in Genome Biology, and this is an area of active research that we are doing. So it's a losing battle. So we need the help from you, from us, from all the disciplines together to try and prevent this huge burden of diabetes, hypertension in our area. So bad genetics, greediness for food and money, poor perception of fitness, gadget culture, lack of exercise, pesticides, heavy metals, and God knows what. And this is where interconnecting disciplines will go a big way. So just a 10% weight loss, just a 1 hour of brisk walking will do this for you. So there's a 20 to 25% fall in mortality, huge reduction in blood pressure, improvement in cholesterol, reduces symptoms of angina, and reduces diabetes. So for all the PhD scholars who are watching this, make a note of this, because if you're going to do some active research with respect to yoga and diabetes, you need to know these numbers. This is what the current scientific community from the allopathic group think should be aimed for. So anyone with type 2 diabetes or type 1 diabetes for that matter, we want the fasting sugar to be between 80 to 130 milligrams per deciliter. We want a 2-hour postprandial to be less than 180 milligrams per deciliter. And a very important test in the diabetes world is this blood test called HbA1c, which is a 3-month average. It gives an average of everyday value of the last 3 months, and we want it to be less than 7%. And blood pressure at the minimum, audit standard 140 by 90. It would be better if it's 130 by 80 or less. And you want the bad cholesterol, the LDL cholesterol, to be less than 100. And the HDL is the good cholesterol. You want it more than 14 males and more than 15 females. And all the scientific studies have shown that if you aim for these targets, you can cause a huge reduction in the risk of heart attack, strokes, and kidney failure in our population. You're talking about 50 to 70% reduction in the risks of these complications. So if you're going to design some studies in yoga where you're looking at an effect of your yoga intervention, someone with diabetes, I think you need to aim for these sort of endpoints. So what are the solutions? I'm going to talk about yoga last, but what are the solutions that we try and do in our clinical practice? We need to think out of the box in India. We need to have Indian solutions for Indian problems. I keep saying 5210 for a healthy life. It's a very catchy term that we tell our patients. All of us need to get a PhD in our life. I'll tell you what PhD that is. Hand dietetics, it's got nothing to do with the parties. It's a non-political hand. A concept called HPS 10K, 30-day habitual conditioning, and ferns. Now, if you think that I'm crazy talking about some rubbish alphabets, these are the explanation. So the 5210 stands for 5 indicates 5 portions of fruits and vegetables per day, of which 3 are vegetables and 2 are fruits. 2 hours of or less of screen time outside of your work. Obviously, if you're working in computer industry, you can't prevent that, but stop seeing gadgets for more than 2 hours. 1 hour of brisk walking every day, and 0 sugary drinks. So PhD stands for we need to have a passion, we need to have a hunger and a discipline to maintain fitness. And I'm sure yoga preaches all these things together. And hand dietetics is a good way of us explaining to patients about portion sizes, viral alavi ennai, finger teaspoons of oil, close your fistful of rice, 2 handful of more of vegetables. And if someone is taking non-vegetarian, palm size of non-vegetarian, and 2 hands folded together to say enough and no. Okay, so it's a very simple way of explaining it to our patients. And again, I keep hearing about happiness and mental peace in yoga. And again, this is an area where yoga might really help our patients, because everyone is stressed out. So we need to be happy. H stands for happiness, PS for portion sizes, and 10K for 10,000 steps per day. And portion sizes is the key, and it's all in the mind. And again, in terms of diet, we don't need any fancy diets. Thiruvalluvar arumiya solrirukkaru, thiyalavinri theriyan peridunenum noyalavinri padu. Meaning, for fire, you know how much to use. So in the same way with diet, you need to know how much to eat and stop after that. And if you do that, you'll not get any disease. And atral aravarindu unga adudambu petran neduduikumaru. Only after your previous food has digested should you start to take the next meal, and that too in the amount that is only needed for your body. So what a simple dietetic explanation by one of the all-time greats around 2000 years ago. And this is our contribution to the society. We run an organization called Ferns charitable trust. The aim is to promote organic farming because we see a lot of pesticides and fertilizer in the day-to-day food that we use. For a cauliflower is dipped 14 times into chemicals, into pesticides before it comes to shops. Grapes, red grapes, green grapes, a lot of pesticide fertilizer used, and they get absorbed into the gastrointestinal tract and broken by gut microbiota to cause hyperglycemia. So we've done a lot of research starting from Madurai to Coimbatore, and this is a rooftop organic garden. I think everyone can try their hand on it. And so around 80 to 90% of our vegetables are from our rooftops. Now we've got around 125 pots, totally organic, and these are some of our produces from yesterday. So just and we've got a lot of medicines for diabetes. Again, there's a common myth thinking that kidney failure MBBS MRCP படிச்ச மாதிரி ஒரு எண்ணம் இருக்கு, meaning that drugs are dangerous and they cause kidney failure. That's absolute nonsense. அதாவது everything has its own side effects. So no side effects equal to no effects. We've got some really good medicines for diabetes. Again, how dangerous a drug depends on the skill of prescriber. And a lot of these products are originally from plants and tree sources. For example, metformin has been used for 300 years from a plant called French lilac. And the SGLT2 inhibitors, now they've come recently. They reduce kidney failure and they reduce heart failure. And they were isolated from the bark of the apple tree in the 1800s. So we've got some great medicines to prevent heart attack, strokes. We've got blood pressure lowering medications. We've got statins. Side effect kadayada. Don't believe any doctor who says that. Every drug has its own side effects, but how dangerous depends on how the doctor prescribes the medicine. So ways and areas in which yoga can help, from a guy who's got absolutely no idea. From what I read, these are the areas that PhD scholars can focus on. So, for example, Surya Namaskar, it's thought to stimulate insulin production. The yoga asana seems to rejuvenate pancreatic beta cells to produce better insulin. The pranayamas lower blood pressure and improve glycemic control. And these forceful abdominal exhalations help the pancreas. The hasta mudras boost metabolic rate and reduce glucose levels. And even the Om chanting seems to help the pancreatic beta cells. So this is all from an article from Ravindran et al. In 2018. If you've not read this before, PhD scholars, please go to Google. There's a great article telling how yoga practice can cause behavioral changes, psychological changes, and physiological changes that can translate into better physical activity, improved mood, reduced stress. And we talked all about the sympathetic and parasympathetic nervous system, increase insulin resistance, and improve cardiac autonomic function that translates into better health. So my suggestion for the PhD scholars here is that please make it an outcome-based research. So the one area where other disciplines compared to allopathy lag is that there's a lot of anecdotal stuff. One has to believe that this will help, that will help. Whereas in allopathic medicine, we got to prove that. So for example, if I'm talking about a drug called metformin, there are around 300 trials done on this drug for 50 years, proven on crores of patients with an outcome that shows that it's good and has less side effects. So not a single drug can come into the market now without a proper phase 1 to phase 4 research. It takes 12 years for one concept to come in from bench to bedside. So I would strongly suggest you to start doing a clear outcome-based research. You can measure insulin, you can measure C-peptide, you can measure the glucose's HbA1c, and there's a new thing called ambulatory glucose profile. I don't know whether you've heard of it. It's a 24-hour tracker which senses the glucose for 14 days. So if you want to see minute-to-minute variations with yoga asanas or postures or meditation techniques, you've got some fantastic machines now that can do continuous monitoring of the glucose for as low as 2,500 rupees for 14 days. That's the cost of this AGP. So please join hands with us. If you're interested, come and talk to me, and we can get the clinical side of things sorted out for you. So there has to be an interventional group, there has to be a control group, and you're going to follow these patients with these kind of hard outcomes and see what happens. And we need to randomize them properly and follow it up. So this is from the diabetes side of thing. The thyroid, I'm going to have only 2 slides because thyroid, I'm not very sure at all, because thyroid needs medicines. Because this gland is in the neck that secretes a hormone called thyroxine, which is a burning hormone. It's like a petrol from the car fuel tank. It comes into the bloodstream and it goes to every single part of the body for burning energy. So without thyroid, the body goes into a condition called myxedema coma. So it acts on every cell of the body. It's critical for brain and somatic development, basal metabolic activity. It helps adrenaline and noradrenaline act on the heart, and it regulates energy, protein, fat, and carbohydrate metabolism. And some of the basics that the scholars need to know, these are some of the tests that we use to measure thyroid function. And again, if you're doing some research in thyroid, these are the tests that you need to know. The TSH is the most sensitive test for thyroid dysfunction. So even a small change in the thyroid level will cause big changes in the TSH. It's a hormone from the brain that controls the thyroid. So if the thyroid level is high, the TSH level will go low. If the thyroid level is low, the TSH will go high. So it's inversely related. The free T4 is the level of thyroid hormone, and T3. So T4 and T3 are the two types of thyroid hormone that we deal with. My only point here is that whatever you do, for example, this is a lady with hypothyroidism who stopped the tablet for 6 months, and she ended up with a condition called thyroid coma. The cost of tablet is 1 rupee. So please, patients on thyroid medications should not be stopping the medications without doctor's consent. So this lady comatose, seizure, sodium of 106, normally 135. TSH value normally should be between 0.2 to 4.2. And hers was 247, meaning if the TSH is more than 10, thyroid level is 0. 247 is absolute 0. And unfortunately, we lost this patient 2 days after admission because she didn't take her 1 rupee tablet properly. And what did she do? 6 months, she went somewhere and took all these liquids, God knows what, and the tablet cost is 1.5 rupees, thyroxine. So mortality rate of myxedema coma, even with best treatment, is 40%. Intravenous thyroxine is around 6,000 to 10,000 rupees. One ICU admission with thyroid coma is 1.5 lakhs, and the cost of the thyroid tablet is 1 rupee. So it's important that patients do not stop these tablets without doctor's supervision. So thyroid and yoga, I've gone through the literature. It seems that some of the poses seem to help the thyroid. So you can try it based on the outcomes that I've told you, but patient must not be asked to stop any thyroid medications without a doctor's supervision. And that's all I've got here. So I'm happy to be open to questions and discussions from here on. Thank you.
Thank you, doctor. Fantastic. So over to Dr. Ravindranath.
Now I will ask Dr. Shanmugavel.
Good evening, sir. Swaminathan, you've done a very good job, and it's really an eye-opener. And you showed the statistics. Usually we read the statistics means all foreign countries only. We never see an Indian statistics, and even if we see an Indian statistics, we will be doubtful because we will convert it according to our convenience. But your statistics appears to be very genuine, and it shows Kalapatti and Tadagam. Tadagam, I think, between rural and urban area. Kalapatti is pure urban area. In that way, if you see even between Tadagam and Kalapatti, we can see.
Audio is feeble, doctor. Can you just look up the audio? It is not.
No
sound at all.
Minadi we were able to hear, sir. Now no sound.
Doctor, no sound. No sound.
He will come. He will correct it. Just you wait.
Thank you, sir. I think he makes an important point. Research pati pesrana. I think we've got to do some proper research here. That's lagging in the Indian context, and we wanted to change that. This is 2 crore project, these 3 things together, but it was all possible because of our chairman's dream. He wanted to know, nee London la pesra, America la pesra, Coimbatore la enna irukku kandupidipom abindar. And just because we did that, it opened the door for us looking into pesticides and fertilizers in rural farming villages. And we found a big link there which needs further pursuing. So thank you, sir. Thank you.
அதே தான் சொன்னேன். இந்தியன் ஸ்டாட்டிஸ்டிக்ஸ் தான் நமக்கு ரொம்ப முக்கியம். அதுலேயும் The pesticides, we should know what are all the pesticides which are doing specific problems. We should try to advise the farmers to avoid that, because our rooftop gardening and all I am finding very difficult, because for 3 months we can use that. Afterwards, the soil which we are using becomes stale and we have to change for a new soil. So replenishing the soil is a difficult in rooftop gardening. So we should address our farmers and we should try to change it. So for that it's good, but your advice regarding our research also good, and easy parameters, not difficult parameters, easy to follow. And you said that you are going to help us. Definitely we request you to help us, and your people are going to approach you. Thank you very much, sir. Thank you.
Yes, thank you. I think in terms of AGP, I can straight away promise that I can give you 5 machines free of cost, sir. 14-day tracker. I think that would be great for you to assess the effect of meditation yoga on continuous glucose levels. So I think straight away I can authorize that.
Yes, yes. That AGP nobody knows very well, but if you show that machine how you are fitting to the height, how the needle inside, and if you explain it, our people will get the idea to use it. Thank you.
That's right, sir. It's just a very tiny sensor that's attached to the arm here, and there's a waterproof material over it. So you can walk, talk, bathe, do anything you want. And that filament inside, it's not a needle, and it continuously senses the interstitial fluid glucose, and it records it in a microchip. So 14 days, it records around 288 glucose levels per day, which is impossible to do with your finger prick. So that in 15 days, you'll have a beautiful graph of minute-to-minute variation from midnight 12 to the next day, midnight 12 for 14 days. So that you can, for example, if you're doing one particular yoga on that day, you can mark the time on it and you can correlate with your AGP recordings. So we can have a control group where they're not doing it and an intervention group where they're doing it. And then we can see whether there's any variability in the glucose levels at that particular time.
So your talk has shown.
Surely we can work on.
You concentrate on the local, the place where you work, and your identification of the pesticides and the newer cleansing agents is very much significant. Now, even if you say that the Vim bar or the other detergent K is more harmful than the conventional ash powders which they were using, people are not going to change because it is so easy to wash with the detergents, and the time taken for the ladies who are tied to the kitchen, it eliminates a great deal, and our effort has to be much more than the chemical to overcome it. And this easily consume so much more than the pesticides used in the field. These are home poisons. They are much more, and we have to look into. And you have shown the way out also with your terrace gardens, kitchen gardens, and that is a very deep change maker in the food we intake. It is the kitchen garden or the roof garden is a very good item which has not attracted, which has not been given its due share. And if it is promoted, a lot of food related problems, the calorie problems or the chemical poisoning can be taken out. Organic farming will not be sure about it, but with your own kitchen garden, you can be doubly sure of it. And there is no this thing, and it is so easy to maintain, and it is the psychological effects of having a garden in your own house is so much, and the items you are getting are fresh. The time taken by the brinjal from farm to the kitchen is so much that it loses much of its vitamins and the minerals are lost. Whereas the time between the plucking of the brinjal and cooking is a few hours in kitchen garden. So this is all very much. And fortunately, to encouragingly for you, uh, yoga people are all interested in the organic and in the, they are vegetarians and they preach vegetarianism. And this is very appealing to the yoga crowd. Thank you.
Thank you.
Now, we'll ask Dr. Devi to.
வாழ்க வளமுடன். Thank you, Dr. Swaminathan.
Thank you.
We are impressed with by your speech, and want to tell you that Dr. Rabindranath and myself are just 1 year junior to Dr. Nalla Palniswamy in Stanley Medical College, way back in 1968 we finished.
Great, man.
So we
And
also
the additional
said that, and we are happy that he came out of this. He got a punarjanmam again. And your college, your hospital has been doing yeoman service to the people of Coimbatore. But this is the first time we realized that such a big research work has been going on here. We doctors were not aware of it. And I was most impressed by the concern you have for the financial aspect of the patient and the family more than anything. At every turn, you were just expressing the financial loss to the family, the cost of drugs, the cost of invocation, all that. I could really see the pain in that you have gone through. And I tell you, this is one of the reasons why people are going for alternate medicines, because they cannot afford the investigations, treatment and all that, but they end up paying much more for that. But in this context, I would like to say that yoga can be a very good complement to your practice. And I'm sure you would take it up and refer some patients and conduct these studies and see the effects. So without any expense on their behalf, only their time and their energy and a little bit of a willpower is necessary to take yoga as a complement to the already. We never tell them to stop medicine, but as you see, the doctors, as it goes on, they can reduce the medicines, or we can see that the complications are postponed at least by. We want to prove that because everything now is evidence-based medicine, so we want to also your help to prove these things so the doctors will take up. Because one complaint about allopathic doctors is they're not open-minded to other systems. I'm not asking them to be open-minded about all the system, but yoga is a different category. It is not an alternative medicine. It's a preventive medicine, and it's a complementary medicine for any system of yoga, any system, whether it's allopathy, naturopathy, or Ayurveda, whatever it is, it can complement everything. And I have seen it in my obstetric practice of 50 years. Every patient, I have cured dysmenorrhea cases with just yoga practices. I've cured irregular menstrual disorders. I've cured infertility and PCOS. So many things I have cured just with complementing yoga practice with my practice. So I would really like your association with this group. And we are thankful that you offered to give those glucose monitoring equipment also. And with that, we will also do it as a team study. And because of your vast experience in research, I think both of us will benefit. Thank you, Doctor.
Thank you, ma'am. I think you made some really important points here. First of all, that pain of seeing our patients. Like today, we had around 4 amputations, all breadwinners of the family, just total lack of education, poor diabetes control. And I just keep telling that enga pakkam varakudadu. You shouldn't be getting admitted under us and run away from us is what we keep saying all the time. You're right in that medical professionals should do better, ma'am. Hands up here. I think they need to spend a lot more time on educating patients, and they should be really open to everything. And being a researcher, unless you're open-minded, you can't do research. So I really believe that every system has got so much strengths. I think we should link everything together rather than saying that mine is the best or yours is the best. So I think there is a limit to what modern scientific medicine can do. Two groups of patients I see diabetes under very good control. One is yoga practitioners, and number two is gardeners, or people who do a lot of agricultural work. So I think I'm open to joining hands with you, ma'am. I think there's such an inexpensive thing that's good for the health and the mind. And why not is my question, but let's prove it as well.
Yes,
Yes.
thank you.
There is no
Great
toxicity with
idea,
yoga.
Doctor. Yeah.
There is no toxicity with yoga. And,
Yeah.
and yoga is holistic. See, in you being a successful diabetic diabetician, how many drugs you use to reduce blood sugar? One drug. To reduce cholesterol, another drug. And to reduce the coagulability, to correct dyslipidemia, another drug. Whereas when we use yoga, with single yoga intervention, you get the glycemia coming to normal, body mass index coming to normal, cholesterol coming down, and the BP coming down, and all the parameters which are contributing, worsening the individual's health are attended to. And this is without any medicine. And it can go with any treatment, with allopathy or any other pathy, it can go. So this is a wonderful thing. And see, after the institution of International Yoga Day, the acceptance of yoga and the awareness of yoga and the practice of yoga has become worldwide, all over the world. And there is hardly any country which is rejecting yoga. So that is very significant, and all are benefited. And me, I did my post-graduation along with Nalla Palnisam. So we were classmates and roommates and study mates. So, so and still he simply referred, you go to Krishnan for any research collaboration. So I am glad that you have brought the element of collaboration.
I'm humbled.
So we will definitely do it, sir.
Sure. And, so once this COVID is over, we'll have a meeting, sir. We'll have a meeting to be very clear in what we are going to do. So patients recruitment is the easiest part for us. We are such a big institution with a huge clinical load. So we can always ask an added question to the patient. Are you keen to be a part of this yoga program? We can start it in a very simple way, and we can have a control group and a intervention group. So I think it's very doable, sir. It's very doable.
Yes. Our yoga system is quite human friendly. Anyone from the age of 5 to 95, they can practice. It is not difficult. Especially some of the asanas and the pranayama practices are difficult, whereas this one is very easy and people can take it up very easy. The compliance will be more. And we have enormous number of yoga teachers, around 18,000 in the trained, qualified. They have studied MA yoga or MSc yoga. And we have a good number of PhD scholars and MPhil scholars, around 400 people available. So we can do it. And the difficulty of enforcing the lifestyle changes can easily be done with the Sky Yoga.
Sure.
And lifestyle changes are so important, so effective, but least followed for want of time in the case of the doctor as well as the patient. So we don't spend much time in lifestyle, but leave the lifestyle to us we will implement the lifestyles. And you are the best judge. You will be the first thing, and the best thing is the lifestyle to be implemented in a this thing. So it is a good partnership, what we call a win-win situation. Whoever takes it up, the treating doctor, the scientist, the yoga man, and the patient himself, all are to gain only, no one to lose. You don't have such a situation in many of the areas where we work.
Totally agree, sir.
Thank you. Thank you.
And if,
And,
I want to come in just
Dr.
for a minute.
Swaminathan is there?
No, just for a minute. Can I come in?
Yes, yes, please.
Please come.
Doctor, I want to make one more suggestion. See, every day, of course, we read in the newspapers, we see that doctors are giving interviews in the TV and all that about the prevention of diabetes. And really, we know that it's a preventable disease, or at least you can postpone the onset of diabetes. But, the people, it doesn't go into them. When they read the paper or see the TV, it doesn't go into them. I take awareness camps or awareness talks and small groups of ladies and students and college students, office people in the mills and all that. So when you talk to them personally, the middle of time. But then we have a lot of people in this group, it's like the PG students and all those yoga teachers and all that. So if we can train them fully about whatever you said and the aspects of it, we can ask them to go and give awareness speeches in many of the areas. And we have a lot of mandrams, we call it, where people meet every week or even every day. Before this COVID, every day people meet, small groups of people. And then if people can give them awareness speeches directly, and that will, I think, go a long way in preventing this diabetes. Because when I tell them that before you get the diagnosis of diabetes, your problem has started 5 to 7 years ago, they're really surprised. They said, is it so? And I say, you can find out, you can diagnose the pre-diabetic state itself, means you can even reverse the problem. So all these things have been emphasized before they come to us as a diabetes patient. So I think you can consider that option also. Thank you.
Sure.
Thank you. Mr. Mabani Rajan, please. Mabani Rajan is our senior scientist.
Hello, sir.
Working on the government side.
Welcome to
Based at
Mabali Rajan.
Calcutta.
He is from Delhi. Please come, unmute yourself.
Calcutta now.
Unmute, sir. Unmute.
Yes. So I was in Delhi. Currently, I'm in Kolkata. Basically, I'm a MBBS graduate, and slowly I went into the research, PhD kind of thing. So I'm in Council of Scientific and Industrial Research, CSIR. Okay. So in fact, I think last year when I visited IIT Madras, I met one of your scientists called Dr. Velmurugan.
Yeah, Dr. Velmurugan.
Yeah. He, in fact, he was telling that he was talking about the brick clan workers exposed to the pesticide and the diabetes. So now I understood how exactly you people are doing. And he was also telling that, more research, you people are doing. So very nice kind of thing.
Actually, Dr. Velmurugan is a part of our team.
Okay.
So he was IIT postdoctoral fellow. Now he's a senior scientist at KMCH Research Foundation.
Oh.
And we work with Professor Talapil Pradeep. He's a Padma Shri. I know whether you've heard of him. He's done a lot of work in water, and he's got one of the best chemistry setups in India. So he's my IIT mentor. So Dr. Velmurugan and me are a part of a team, sir.
Oh, okay. So here one thing, because so you talked about like the connection between the kind of organophosphorus poisoning and diabetes. So suppose if you take in a chronic manner, like suppose if we consume the pesticide infested vegetable for a long time, so that may induce, I don't know whether it will lead to a type 1 or type 2 diabetes. So based on your opinion, how exactly this organophosphorus lead to kind of hyperglycemia in a short time and long time? Is it because
That's a great question, sir, because when I came from UK, Scotland to Madurai in 2011, one of my first cases was a 15-year-old girl who presented with diabetic coma. And there was no history of passing urine or feeling thirsty or anything. The child was good till the night of admission. And next day afternoon, 2 o'clock, she was unconscious with glucose of 400, 500 with severe ketoacidosis. So I write in my notes, this doesn't look like type 1, but the child has ketoacidosis. So I give IV insulin, fluids, everything. The next day, glucose levels come down normally, but the child goes into respiratory arrest. The lungs stop around 11 o'clock in the night. So intubate, ventilated. So I come to my home scratching my head. What on earth is going on here? So the glucose is normal. I've done all the right treatment, but the child is worsened and gone into respiratory arrest. So I go into PubMed and do poisoning and ketoacidosis. And I get 3 hits, pesticide poisoning presenting as diabetic emergency. And one child in Mysore, Indian Journal of Pediatrics 2011, took 5 tomatoes from a field where the pesticides were sprayed, and he presented in a very similar situation. And again, DKA went into respiratory arrest. Doctors, one astute physician found this out, and he measured this test called cholinesterase, which is a marker of pesticide poisoning, and it was low. And so I called my ICU at 12 o'clock in the middle of the night, do an urgent cholinesterase. 2 o'clock in the morning, I get a feedback saying it's undetectable. It confirms pesticide poison. So I rushed to the ICU at 4 o'clock in the morning. The parents are outside the corridor. I'm telling, what on earth are you hiding the information from? Did your child take a pesticide poison? And they said that she failed a maths exam and she took the pesticide poisoning the night before. And that presented as an acute diabetic emergency. And then we gave atropine, pralidoxim, intubated, and day 8 discharged, no diabetes. Glucose was normal on a 1-month follow-up. So at that point of time, my research question was, if an acute pesticide poison can cause severe hyperglycemia, what about long-term pesticides that we use in our fruit and vegetables every day? As you rightly point out, taking it for 15, 20 years, maybe is that the reason why there's an explosion of diabetes in India where we are harping about traditional risk factors alone? So we worked with Dr. Vel Murugan from Madurai Kamaraj University. So we did some mice experiments where one group of mice were given monocrotophos with water on the doses that human beings would take for 15 years. And the other group of mice were given normal water. And within 6 months, all the mice which took monocrotophos in small amounts became frankly diabetic compared to the mice which were controls. So then I spoke to Professor Mohammed Abdullahi from Tehran. And Iran, Iraq, they've got a lot of biological warfare. So their authorities in pesticide poison. And he's one of the world's authority in pesticides and diabetes. And he gave me a lot of information on how pesticides seem to affect every single pathway of glucose metabolism. It increases gluconeogenesis. It's directly toxic to the beta cells. It increases insulin resistance. And long-term, taking these vegetables and fruits can cause hyperglycemia is the hypothesis. So in Nallambatti, what we did was we did samples on all 1,000 farming population for serum pesticides, and increasing level of pesticides was correlating with diabetes. And this is the first time in India we've proven that increasing pesticide level in the serum is correlating with frank diabetes.
It's a very nice explanation. I mean, so many is a kind of so acute poisoning lead to acute hyperglycemic condition. Probably there could be a the reversible damage to the beta islet cells, because other things, resistance and all, it may not happen, obviously.
Possible.
Probably, yeah, kind of, yeah. Understand.
Possible.
So,
We don't.
So one more, because it is known that the organophosphorus, being a cholinesterase inhibitor, it will mimic like cholinomimetic kind of thing. So on the one side, I think people have demonstrated that the acetylcholine as such will increase the insulin secretion. So that could be kind of metabolic related things. But what we are talking about, maybe the structural damage to the beta islet cell kind of may happen.
Possible, as well as insulin resistance. It seems to increase the adrenaline and noradrenaline, which seems to cause severe insulin resistance acutely.
Correct, correct. But here, I think this organophosphorus also is more or less matching with the earlier presentation where that the scholar was talking about the sympathetic and parasympathetic. And here also we are talking about kind of sympathomimicry. So now one can understand that like nothing is beneficial. So everything should be in a balanced way. Even the madam, Swatantra Devi madam also used to talk about, even because you see here in the meditation also, we used to improve the parasympathetic system. But in here you see that organophosphorus and poison, here also there is a increase in the parasympathetic nervous system. So meaning the two extreme system, one is like a very mind peace related things, another one is like a polluted related thing. Exactly that's happening. One side you have a deep meditation and you will have a similar effect to the alcohol and drug abuse. So one side abuse, another side is a meditation. Both are having opposite effect, but both are having like a similar pathway, but opposite effects kind of. Yeah. In fact, when you talking about Ramakrishna Paramahamsa, and he also talk about like when you take abin as the drug abuse, and it will create a similar effect to the deep meditation kind of. So somehow it is interrelated. So I want to point one more point here, because we have done some work in the yoga system. There is a person called Dr. Malati. She did one work, because why I want to point out here, because you were telling that like in the gardeners also, when you compare the effect of glucose management by yoga, I mean the practitioners and the gardeners, so both are having a kind of good improvement in the glucose control and all. And here we talk about one is like meditation and yoga, another one is like kind of gym. It's a kind of body exercise. Both, yeah. So in this context, suppose if you're planning some kind of experiment, maybe you can have like 3 groups. One is like control group, another one is like only exercise but not meditation kind of thing, and another one is like only yoga and meditation related exercise. Because what we found that, because in our data what we found, I think we have collected more than like 150 patients, approximately 50 individuals in the control, 50 in the yoga, and 50 in the gym exercise. But we found that we measured a number of hormones related to adrenal gland. So for example, you know very well that like medulla and the cortex, you have a glomerulosa, fasciculata, and reticularis. We measured all the hormones starting from like aldosterone, cortisol, and DHEA, like dihydroepiandrosterone, and the and the epinephrine. But surprisingly, you see that cortisol level did not alter both in meditation group as well as in the gym going group. Here you know that cortisol is a kind of chronic stressful hormone. One should not expect a higher level of cortisol kind of. But we found that both the gym going exercise group as well as the meditation group both showed a similar effect, meaning indicating that even the body exercise also does something beneficial thing that you cannot deny the fact. And importantly, we also measured, along with these hormones, we also measured a kind of happy hormones like oxytocin, melatonin, serotonin. Drastically, the gym going people did not have any change in these hormones. But in the meditation group, there's a drastic change, like starting from melatonin, serotonin, and like oxytocin. Everything is increased. So in my opinion, based on the data what I have with the teamwork, meaning both the physical exercise and the meditation related, meditation plus exercise, do the metabolically do the similar thing, but mentally meditation does benefit, like it gives more happiness and more peacefulness, even though gym exercise is beneficial to reduce the stress. But somehow our data is saying that the happiness index is more in case of the meditation kind of thing. And because we also wanted to know, because you talked about like 10,000 steps per day, but in case of many meditation yoga, so we don't worry much about the steps. For example, in our system, for example, in the sky system itself, we have multiple exercises. Like if you do 1 hour per day, you will feel completely freshness kind of thing. Because based on my experience, but where I think it's a kind of standing. There's a lot of exercise, starting with hand exercise, leg exercise, and breathing exercise. Number of exercises there, but probably that, but one cannot achieve that 10,000 steps. So now I think we need to see whether, I mean, only the yoga plus meditation alone is sufficient to fight with the cholesterol and thing, or complementary. Like complementary means, I mean, combination of this meditation plus yoga plus some amount of, I mean, kind of aerobic or I mean the gym kind of exercise. This combination will help to complete the cycle. So this is very, because when you're talking about the 10,000 steps, is I mean, beyond the imagination of a normal office going people, but it will need at least 1 hour walking kind of thing. But in our system, I think we don't give much emphasis to the, I mean, step, even though we have a lot of complement, I mean, the complete package kind of system. But do you think that like by walking, we are stimulating our peripheral heart, that is a soleus muscle, that will help the cardiac system, sir?
See, the 10,000 step is just taken from ARA. It's nice to say HPS 10K, happiness quotient is 10,000 steps. So actually the concept came from Tokyo Olympics in 1964, where a pedometer company was marketing this for 10,000 steps a day for a healthy heart, and it seems to have stuck. So whether 10,000 is needed or not, I don't know. Would anyone do it? I don't know. But it's a nice number to aim for. But walking generally reduces insulin resistance. So during walking, you don't need insulin for the glucose to go from the blood into the muscles. It goes automatically. So it reduces peripheral insulin resistance.
Okay.
Now, let me intervene. The time is also running out. Yet another area which I don't know whether you are interested or not. It is the primary prevention of diabetes. Are you working on that in your research area?
It's a part of our advice, but with the clinical work being so big, it's very difficult to give a lot. Maybe that's what we should be doing. But I think, as you rightly say, a group of volunteers might do a better work than a busy clinician. But we are harping on that message to everyone.
Yeah, see, yoga works on the core, not on the periphery. It is deep in the fundamentals of the physical body. We talk about the astral body and the causal body, which is not there in the anatomy and physiology. This is the energy and the life force, which is both of them are not coming under the medical system. So this here we produce, the yoga produces some changes. So it is capable of the children born to the yoga couple. They have higher potentials. We call them super babies, and they are healthy also. So this yoga can give a way to prevent diabetes in the probable diabetes prone individuals. So this also can be taken up. It will be a pioneering work in the world.
Sure. See, with our master health checkup, we in a non-COVID time, there are about 80 to 100 patients per day coming for a master health checkup, where there's a lot of pre-diabetes being picked up. So that's a fertile area where we can try that again. You can randomize people, but we've got a huge number of pre-diabetes coming every day to our master health check. So that's what I'm saying. Yes. Patient numbers is not a problem. Selection is not a problem. So once this is all done, we need to go and speak to Chairman or Dr. Arun Palanichwamy, get the permission to get in a program like this. I can put in all my efforts and see where we can go.
Fortunately for us, you hit the R&D group.
I don't know. The final decision is always with the chairman's
Yes,
office.
yes.
Yeah, yeah.
Okay.
But
okay.
we'll put in all the efforts to try and get this going.
So, who is the next presenter for the day?
Valgalam, sir. Shanti and Hemamali are pending. So,
Sorry, whom we will take?
Hemamali,
HRS.
are you ready? Hemamali, are you ready with your assignment?
Sir, can I just
Yes, I'm
interrupt
ready.
here? I've
Yes,
had
please,
around
sir.
15 hospital calls. So is it okay if I make a move now?
Thank you,
I'm
thank
not
you.
to answer to everything.
We have taken all that we wanted from you.
Thank
We
you,
have
sir. It's a
got the,
pleasure to be interacting with
yeah,
all
yeah.
of you. Thank you, sir. Thank you.
So, thank you, sir. Before,
Rangasamy, you
sir,
can.
Sir,
send
Dr.
him out.
Swaminathan, sir, before you leave, in the further meetings and in the further collaboration or something which you are interested, can you kindly help us with a protocol to frame a yoga protocol for diabetes and yogic counseling for diabetes, so which will be integrated approach to encounter this?
No, definitely. I think the more we hear about it, I think we should do it, because Dr. Rabindranath, I'm feeling a bit disappointed in myself that I've not been able to help much, because it's all about MRI scans and nuclear medicine, which is outside of my area, if you remember our discussions before. But I think diabetes is my area. So I think we can do whatever we want.
We will take it up.
Sure.
No problem.
Thank you. Thank you.
Thank you.
Rangasamy, kindly send him with our thanks and well wishes.
Certainly, certainly. It is a great pleasure, and it was a great. I used to always say KMCH is always open. Only thing is where to touch the button. Now you know it. So we will form a research group, and a lot of scholars are available. Also, you have lots of data already. We have been conducting a lot of medical camps. We can share a lot of information from your R&D, and then collaborate in such a way, outcome will definitely benefit, because the way he presented, he is concerned about pain, money, everything came out from his art. We greatly appreciate you, doctor. It was a wonderful eye-opener for most of us, and we are here with simplified yoga techniques synthesized by our Guruji, and we call it Sky Yoga, and it has got wonderful inbuilt mechanisms to fight out. We have a lot of research data available on those who are practicing for 40 years, 30 years, who have no symptoms at all. Those who had in industry, especially, I can share a lot of information about the tension-ridden engineers and the workers in the industrial belt. There are hundreds and thousands of units in which even Coimbatore is also not only agricultural side, you have seen industry side, you see how they are suffering. And all those things will have to be taken into account, and we can form a good research group and work very closely, and so that the humanity as a whole benefit. And thank you so much, doctor. Thank you for everybody. Anyone who have
one more
minute.
Which one more minute, Rangasamy. Let me introduce our senior respected members from USA, Dr. Indra Gupta and Dr.
Oh, sure. Thank you. I forgot actually.
They are the backbones for this group. And Dr. Indraji, few words to Dr. Swaminathan.
Dr. Indiraji, Indira Gupta,
it's on mute,
and
madam.
Please come. Yeah, they are from US. And where our Swamiji, whenever he went to US, he used to stay with them, and more than 20 times. And they used to arrange all the visits in US. They have a lot of close coordination and data with them, and they can come and share with us.
Yes, Indraji.
For giving this information
to raise all of us. Our consciousness is with yoga and the medical profession in a more Western and scientific arena. And that is needed to come together. And I think it is the collective consciousness that we need to raise. We are all in helping profession. Our hearts, the intention, purity of intention will help the people who really need it. And you are also a catalyst, and we appreciate your presentation. And it's been very, very revealing that where we can meet the interface, that's what India can really, really share. Because here we have so much of technology. AI is taking over in medical professions, you know, but India has the other side, which is Dr. Rabindranath is saying that it is coming from the heart. And that's where the interface is. And we appreciate your presence and your collective consciousness raising with the expertise that Western science is sharing. But that also needs elevation. Thank you. Vijay, you want to share something?
Thank you, ma'am. Thank you. All your blessings are needed. Thank you.
Thank you.
Well, I want to say that your presentation on diabetes was very insightful. My father and my brother died of diabetes. So I'm very aware of the problems. So it really needs the yoga interface. And you're in a yoga group. Dr. Rabindranath is connected to Aliyar. So you can talk to him, find out more. Your patients, how they can be benefited through yoga, meditation from diabetes. Okay, thank you.
And your openness itself is the platform. We love you. Thank you.
Thank you. Thank you, ma'am. Thank you.
Thank you so much.
Good night, everybody. Thank you. Thank you.
Good night.
Thank you.
Thank you,
We are
Andhraji.
all grateful for you, and we give you a warm of sent on. Thank you very much.
Anyone else? Any other research scholar?
No,
Waiting.
not now.
Otherwise,
He
we
is
can.
delayed, Rangaswamy. We will send him off and
We can,
continue.
yeah, we can close it, and we will see the other scholars in the next session. Okay.
Okay.
Thank you very much, and we want to thank each
Hema
and every one
Malini
of you
and
for your
Sir,
active
Hema Malini and
participation.
Shanti are there.
Shanti.
Shanti. Yeah, yeah.
Yeah,
we
Shanti,
will take
come
care
on.
of the next time.
a minute or so.
Okay.
Okay, sir.
Thank you
Shanti,
for
can you
accepting.
unmute and come quickly?
வாழ்க வளமுடன், sir.
No, please.
Ramadan?
Am I audible, sir?
So far you were not. Now you are audible. Come on.
I'll share the screen. Is it visible, sir? வாழ்க வளமுடன் to all. My assignment on Kayakalpa Yoga. So the questions are, what is Mahabandha? What Bandha are followed in Kayakalpa? Methodology to be followed in Kayakalpa. So the Bandha, Mahabandha literally means great law. In Hatha Yoga Pratipika, two techniques are used for doing this Mahabandha. In technique 1, the slokas 19 to 21 explains that performing Jalandhara Bandha and Moola Bandhas constitute this Mahabandha. And also, as note was given in Sloka 22, it says that some of are of the opinion that instead of performing Jalandhara Bandha, one can keep the tongue pressed against the roots of upper teeth.
Soft palate.
I think Maharishi, Maharishi would have followed this technique for doing Ojas breath in Kaya Kalpa. That is Mula Bandha and rolling the tongue to the upper palate of the mouth. Okay. But in the technique too, in the sloka 76 says that bandha is to hold three bandhas: Jalandhara Bandha, Udyana Bandha, and Moola Bandha. So in Kaya Kalpa, we use this technique 1 of Mahabandha. In the KMCH Samhita, it also adopts the technique 1 for doing Mahabandha. So about bandhas, Swami Mukti Dodananda from Bihar School of Yoga, in his book Hatha Yoga Pratipika, describes Mula Bandha as the contraction of perineum or cervical region. But Mr. Pancham Singh, who has translated Hatha Yoga Pratipika of Swami Atma Rama in 1940, and he explains the sloka 61, says that Atah Moolabandhah Vashini Bhagena Samvidya Yo Nima Kunche Budam Apana Mudamakrishya Moolabandho Abhidiyate. Here I have highlighted the word Budam, which means the anus. He says the contraction of anus is Moolabandha. So we in Kaya Kalpa, we do this contraction of anus for doing Mula Bandha. Then Udyana Bandha and Balandhara, they have the same concept. That is, Udyana Bandha is contraction of abdomen region, and Jalandhara Bandha is contraction of throat. The third question, methodology of Kaya Kalpa. In Kaya Kalpa, we do Ashwini Mudra and Ojas breath. This Ashwini Mudra is a rhythmic deep contraction and relaxation of anal sphincter muscle. We do Ashwini Mudra for 10 times. And then it is a preparatory procedure for Mula Bandha, and it strengthens the pelvic floor and increases the ojas, the driving force of life. And under Ojas breath, we perform Mula Bandha. The Muladhara chakra gets stimulated and gains angular momentum to move in upper direction. Here, I should explain about this direction of angular momentum. Whenever a body spins, then angular momentum will develop perpendicular to the direction of its rotation. So in the same way, when Muladhara chakra gets stimulated, where the energy is supposed to be spinning in motion, it gains angular momentum to move in upward direction. So after Mula Bandha, we roll the tongue and touch the upper palate of the mouth. So this is the stage 1 of Kechari Mudra. It locks the energy from moving downwards. And also after that, we do forceful quick inhalation with awareness, fully on bringing energy from Muladhara to brain. That is Sahasrahara. Then we release Kechari Mudra. With long forceful exhalation through clenched teeth with awareness on the whole body. This increases the immunity levels to fight against the diseases. As the energy is channelized from the base of the spine, that's Muladhara, to the top of the head, Sahasrahara, and it is spread all over the body. Varha Valamudan, this is the methodology of the Kaya Kalpa, to my understanding. So, these are the references. Thank you so much for giving the opportunity to present an assignment before you all.
Thank you
Next,
for
next
doing it
Hemamal is.
in the crispy way.
Thank you, sir.
So
Okay.
next Hemamalini, sir.
Hema Malini, now how
Thank you.
much
There
time
was also
will
some
take?
echo in your audio.
Hema Malini, how much time you may require?
5 to 7 minutes, sir.
Right? We will be happy to finish it off, even though it is 10:20. Just finish it off fast. No?
Thank you so much, sir. Varha Vayyagam, Varha Vayyagam, Varha Valamudan. Am I audible, sir?
Yes, yes.
Varha Valamudan. Thank you, one and all present here. And my humble pronounce to all the noble doctors present here in this forum. Be blessed by the divine. I am Hema Malini, PhD scholar from WCSC, Vision for Wisdom. My assignment question is how to increase the efficiency of Kaya Kalpa and how to conserve the ojas. So before beginning for how to increase the efficiency of Kaya Kalpa, how to conserve ojas.
Right. Okay. Good.
So ojas. So to begin my presentation, I thought it's better to talk about ojas, sir. So ojas. So in Ayurveda, they are the spelling is OJAS. According to Maharishi, it is OJUS only. So while taking the references, somewhere it is coming as OJAS. So what is ojas? The purest substance in the universe and omnipresent in the human being. It is the ultimate energy reserve of the body and mind. Ojas is an essence present in every dhatu and considered as Sara of all the 7 dhatus starting from Rasa to Sukra and responsible for all the strength of the body. Ojas is responsible for the consciousness, purity in thought, health, positivity in feeling in every situation, for better immunity, longevity, intelligence, and memory. Ojas is one of the important elements for maintenance and sustaining of life. All human beings are well nourished by ojas, and it decrease leads to cessation of life. Though it is located in the heart, it pervades all over the body. It controls or regulates the whole working of the body. Ojas is a total defense system which protects the body from disease. In Veda, ojas is referred as bala, prana, virya, and kapha. Bala means strength because it provides strength to the body in terms of physical, mental, immunological, and resistance of the body. Ojas is the nectar or the essence and is the end product of various physiological processes. Repeating the name of Lord, doing intense japa and meditation and chanting Gita or Bhagavata, the Ramana and like develops the Viveka, Vairagya and Vichara. As dispersion increases, the vital energy is not allowed to leak out. The greater the Vairagya, the greater will be the transmutation into ojas, says Ayurveda. So qualities of ojas has been explained by Acharya Charaka. It is heavy, cold, soft in nature, smooth, which spreads into the minute channels, sweet in nature. It is stable, it is pleasant, it is sticky and oily. Main functions of ojas. Ojas is very useful to maintain the condition of good health. It nourishes the mind too. It regulates all the physiological activities and immunity power of the body. Ayurveda believes that life cannot exist without ojas. So according to Ayurveda, they have given 3 abnormalities: oju visarana, oju vyapada, oju kyaya, shaya. So first one is like, for example, there will be a loosening in joints. and a small immobility will be in the stage 2, and in third stage, full there won't be any activity at all in the joints. So factors responsible for reduction of ojas: excessive physical exercise, fasting for a long time, constant worry, consumption of food which are dry in nature, consumption of less food also responsible for reduction of ojas. Excessive exposure to heavy blow of wind and sun, fear, grief or sorrow, drinking strong wines, keeping awake at nights, excessive elimination of kapha, blood, semen and mala, urine or feces. Due to old age also, reduction of ojas is possible. Mental and physical trauma or injury to vital parts. Anger and excessive sex is also responsible for reduction of ojas. So ojas can be increased in the body by the following measures. So happy atmosphere helps to keep the mind in a happy state. Hot spices of foods, fried foods, alcohol should be avoided. Bitter, sour, pungent substances should be avoided. To improve the flow of ojas, sattvic food like organic milk, clarified butter, almonds, sesame, honey, rice and fruits should be consumed. Consume foods or medicine which are sweet, cold and lighter in nature. Life promoting medicines like meat juice, milk and its preparations should be used. Some of the practices of yoga like Sarvangasana, Sirasasana, Viparitikarani will also help to improve ojas. Daily mantra, pranayama, mudra and meditation and nourishing the heart with love and contentment will also help in improving ojas. Pranayama helps a lot in gaining control over the physical and mental power to have control over the prana shakti and prevent from being let out. Abundant ojas helps the aspirant to glow spiritually. Intense sadhana with less desires will sublimate the sexual energy into spiritual energy. So according to our Swami Vedatri Maharishi, he has said in a simple way, limits and method is essential with simplified physical exercise, meditation and introspection to live a healthy life, which in turn improves the ojas. And importance of thoughts, words, deeds was emphasized by Maharishi. So how to increase the first question, this is the first assignment question, how to increase the efficiency of Kaya Kalpa? A regular practice of simplified exercises and practice of meditation on daily basis, and increasing of the biomagnetism by practicing lamp and mirror gazing will help to increase the efficiency of Kaya Kalpa. So as such, Kaya Kalpa should be done with a focused mind, that is with a meditative mind, which will improve the energy of Kaya Kalpa. So these are the benefits on regular practice of Kaya Kalpa. So toning of muscles, childbirth is pain at childbirth is reduced, slows down aging process, and maintains youthfulness, postpones death. All the endocrines are strengthened, improves the functions of all the endocrine systems, and improves memory, sharpens the intellect, increases the biomagnetism, strengthens the anal and sphincter muscles. Insomnia is cured. So Kaya Kalpa Yoga controls asthma, diabetes, piles, liver diseases, and cures skin problems and heals ulcer. It improves the chances of recovering from blood cancer too. It cures migraine. So some of the benefits are add-on. So these are the references: Vital Nectar of Life from ResearchGate, and Concept of Ojas Scientific Overview from ResearchGate, and Ojas, Tejas and Prana from Ayurvedic Journal. Thank you.
Thank you.
Very nice.
Thank you very much.
Your type 1 Bandha explanation will be attractive and explaining many doubts of our sky practitioners. It was very nice, and we need time to question you. I hope, I just wonder when Maharishi will give us time to question you people. We will have it next time possible. I thank all the three scholars who presented their assignments diligently with all seriousness and You have taken pains to prepare the presentation. We appreciate it. And we will be making real use of it soon. Thank you for your contribution. And Rangaswamy Ayya, it is 10:30.
Thank you very much.
I'm
One
sorry
minute.
about the disruption
Anything
because there
else
was a
from anyone
power
else?
shortage and
You are
then my
in
Wi-Fi got cut
silent.
and then it took some time, so I couldn't complete the summary. So I'm very sorry about that.
We will do it next time.
And
Anyway,
now it's very late for that also.
because of the problem you had with the technology, we had more time with our Mr. Krishnan Swaminathan.
Oh, yes. Okay, sorry.
Okay. Thank you, ma'am. Sorry, I didn't mention you. You started well, and we all appreciate it.
A little bit of
Hope
a
we will
disturbance from
do it in the next
the
week.
audibility of Sundara Devi's this thing, so we couldn't complete it. But
Rangaswamy Ayya, you have
it's nicely
audibility.
narrated. Yeah. Can we close it, sir?
Yes.
Can I say one tribute to Dr. Rabindranath's efforts?
Yeah, come. You are always welcome.
Dr. Rabindranath has such a purity of intention and the thought force, and he's bringing these very, literally you are engaging these people. So I have another system I'm developing, I have invented called Mind Mail, MINDMAIL, just like email or smart mail or whatever. Mind Mail. And Dr. Rabindranath has plenty of it. Thank you.
Thank you. Thank you.
We love you for what you are doing, really, both of you.
It is a collective effort, ma'am. Because of these people only, we are able to do so much. So I thank all the participants and thank you very much.
Thank you.
With Rangaswamy's permission, I close the session.
For the great compliments received from none other than Dr. Indira.
Audio is not okay.
Yeah, thank you very much. And
Muthumani Ayya.
to everybody, thank you, Mahabali Rajan. And now
Muthumani
you are
Ayya.
in Calcutta, all of us going through the second wave or third wave, which we don't know. We will all continue these great efforts and bring together the eminent doctors and scientists together to fulfill our desire of showing evidence to the entire world as a scientific philosophies of our Guruji Vedadri Maharishi. Thank you very much to all of you patiently going through this for more than 2 hours. Thank you.
Thank you.
வாழ்க
வளமுடன். Your thought force is working. Big thought force.
It has to work because background work is there, a lot of coordination by doctor and stimulating us, every minute is inspiring us. So that is continuing, and we will make sure that these great sessions continue to give great fruits and efforts.
Yes.
Of course, without any of this, all organic will come.
Yes. Bye. All the best. Good night, good sleep, sweet dreams.
Yeah, thank you, scholars, for the excellent. We didn't have much time for all of you, and Hema Malini and our who else was there? First was Tamare Selvi, and then Shanti. We didn't give you much time for Tamare Selvi, but nevertheless, we will continue this and participate in the same way, and we will see you all in the next week. Thank you very much.
Thank you.
வாழ்க வளமுடன்.
வாழ்க வளமுடன்.
Be blessed by
வாழ்க வளமுடன்.